I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida, with the Whitford Thomas Group, speaking to you today about symptoms with anxiety as well as depression. Anxiety and depression are one of the 2 out of 4 blocks to happiness. The other 2 blocks to happiness are anger and guilt. Anxiety as well as depression will have 2 types of components or drivers for the symptoms of anxiety and depression. You can have a thinking anxiety or depression as well as a chemical anxiety and depression. Sometimes it's difficult to determine what comes first, the chicken or the egg. In this case, is it the thinking that drives the depression and therefore the chemistry gets kind of off, or is it the chemistry's off, which then affects the thinking? But when we look at symptoms associated with anxiety, they're very closely related. Probably common symptoms of both would be the tendency to become fatigued or tired often. Anxiety symptoms tend to be more correlated with kind of the motor running too fast. And so oftentimes what you get with anxiety is a lot of physical discomfort, increased perspiration, heart rate, tension and headache tension, muscle aches, and a behavioral symptom certainly is an avoidance. With depression, because of the tendency to depress the mood, the symptoms you tend to see with depression are insomnia, difficulties in eating as far as an appetite. Other symptoms associated with depression would be a lack of motivation, inability to concentrate. You don't get a lot of physical discomfort with depression like you do with anxiety, but certainly the consequences associated with both depression and anxiety symptoms tend to interfere in our lives. I'm Dr. David Thomas, speaking to you about the symptoms of anxiety and depression.